Hey, Delia Boppers, what's up? So this is a bit of an impromptu stream. Just have some things I need to put out there. This is kind of the quickest, easiest way to do it. So those of you who follow me on social media may be aware of the fact that I've been having some concerning things going on. Um, Basically, I've been experiencing chest pains over the course of the past 4 days now, which are getting a little bit better. It's really kind of hard to tell. So they started about 4 days ago. Kelly and I had been invited out to a nice dinner by one of our friends who were also nice enough to um, cover us as well, which was really, really sweet of them. But we were waiting outside. It's kind of one of the more popular restaurants around the area. And there were a lot of people out there, so I wasn't sure if it may have been stress at first, but I don't usually get chest pains with stress. I do get other sensations in my chest with stress, like palpitations, I guess sometimes, but they feel really different. Um, Basically, what I noticed was that I couldn't quite breathe. Like I was in the middle of all these people, and I was trying to breathe, and my breath was getting shorter, and then all of a sudden it was just like there was this sharp pain that happened in the middle of my chest, um, and it kind of stopped my breath, and it kept happening like anytime I would inhale sharply, um, or anything like that. So we kind of went on with the evening. I was really frightened. I had no idea what it was. I've had issues with like laryngopharyngeal reflux, which is different. Like it doesn't cause heartburn; it causes throat issues. Um, I've never really had heartburn issues or anything like that. Although I'm sure there's probably like a lot that's wrong in my esophagus from having the LPR for so long. Um, but it didn't go away. It kind of like it would come and go a little bit. Like over the course of the next few days up until now, there's sometimes when it'll happen, sometimes it won't, even this morning. So um, it's concerning. It's really concerning because of the fact that transgender women who are taking estradiol, really actually any women or anyone, at all who would be taking estradiol for any reason, as a hormone replacement, does have an increased risk of blood clots, which, if they get in your lungs, can cause similar symptoms to what I'm experiencing, or in some cases, the first symptom anyone experiences is that they suddenly die. Um, so, yeah, that's scary. That's really scary, and that risk is higher for people who have smoked, which I don't anymore, but I smoked cigarettes for the most part of the past 7 years of my life, including the first 7 months that I was on hormone replacement therapy. So it's very frightening. Um, this is like one of the huge reasons why self medication is really discouraged and why you're supposed to see a doctor for your hormone replacement therapy. It's not just, worrying about black market hormones and things like that. The main concern is that you need to have your levels checked. Um, Unfortunately, the endocrinologist that I've been seeing has flat out refused to do any blood work to check my levels in the entire year that I've been on hormone replacement therapy under his care, and is still not checking them now. I'm actually switching doctors for that reason because that's flat out irresponsible. I wonder if it might be malpractice, but obviously I have bigger concerns at the moment because I have no idea what's going on inside me right now. And I really kind of have no way of knowing. Um, I kind of first came out, really, really came out about this weekend. I mean, I've kind of made mention to it little bits before, but it's really hard for me too because, like, I don't want to feel like I'm begging. Um, but I don't really make much doing what I'm doing. My ad revenue is like, um, it's not much just because I don't get very many views. So most of what I make comes from Patreon, which is about like $300 a month, and that's not enough to afford insurance. And I can't even get my divorce taken care of because I can't afford that. And even then, it's like, that kind of leave me free to get married to someone who had insurance if that was a way of handling it. But I mean, I wouldn't marry someone just for insurance anyway. So it's really really difficult to know where to go. Like I can't pay for a lot of these things. I mean, you can go to an emergency room; they don't charge you up front, and that may just end up being what I have to do. Because when you're transgender, no one really cares about your health. They do what they have to. The endocrinologist I've been seeing, they didn't used to take insurance for transgender patients back when I had insurance. Of course, they do now that I don't. But just basically because, the Affordable Care Act makes sure that they have to take insurance without regards to gender identity. Um, but there's nothing making sure that they take my levels like they would for a woman who was not transgender, because that they wouldn't dream in a million years of not checking my levels if I was a cis woman that they were treating. Um, it needs to change. It really, really needs to change. And legislation can only do so much. It's the attitudes that need to change. And the fact of the matter is that trans women's health is just as important as any other woman's health. And I mean, with that in mind, I called Planned Parenthood this morning. I'd gotten a couple of donations from supporters over the weekend, which I figured would be enough to cover that if I just went there. The problem with that is that they don't provide care for transgender women in the Southeast, apparently, which I was really surprised by. And it's really saddening because, obviously, as a feminist who cares about all women's health and about all uterus owners' health, I've been a huge supporter of Planned Parenthood. Um, but I find myself in the position where I'm really kind of having to reconsider that now, because if they don't care about transgender women, they don't care about all women. And I'd like to see that change. I know that there's a lot of places where Planned Parenthood does provide health services for transgender women, but it's not everywhere. And it needs to be. And it needs to be everywhere without someone forcing it to be. There shouldn't be anything that comes out from any administration or a lawsuit being threatened that makes it to where Planned Parenthood and everywhere actually takes care of transgender people. And I mean, it's easy to say, oh, you can just go to an urgent care, go to the emergency room, go to your general practitioner, go anywhere. But the problem is that they just don't care. If I go to an urgent care, it's absolutely illegal for them to refuse to see me because I'm transgender. It's absolutely legal for anyone to refuse to see me because I'm transgender. And we've been trying to fight this with human rights ordinances, but those get bogged down because of the whole fucking bathroom debate. And it's scary. It's really scary not knowing what's going on inside you, because it could be a number of things. It could be really really stubborn gas that I've had for 4 days. It could be a heart attack waiting to happen. I don't know, and I have just reason to be concerned about that. I don't want to freak anyone out. I mean, I hope it's for the best, but I mean, I hope everything turns out for the best. And it's not anything life threatening. That would be wonderful to just go see a doctor. If you told, oh, you just have some gas, it's fine. Get my levels checked and find out, oh, look, your estrogen's not dangerously high. Maybe it's even low. I don't know. I just don't know anything right now. Um, but so I've gotten some information, some advice, along with the donations that I'll need. So thank you. Um, and I'm gonna go to I'm gonna set up to go to get my estrogen levels checked, and me and Kelly are trying to figure out if maybe I might just end up going to the hospital, going to the emergency room. Um, but there's always that fear that I won't be seen, or that the doctors may just say, try to take me off estrogen and be like, oh, we just have to take you off estrogen. That's our only option. if there was a blood clot as opposed to actually looking into like a blood thinner or something. Um, or even there's the whole transgender broken arm syndrome, which sounds ridiculous, but it's a very real phenomenon where doctors just decide that the second a transgender patient walks in their door, everything they learned about the human body in medical school apparently goes out the window. So I just this is the kind of shit we need to talk about. This kind of shit because it's not right. Obviously, my circumstances are a little different. I'm someone who's self-employed, and basically, everything that I make is off of the charity of the amazing people who watch my videos and appreciate the work I do and want to help me be able to continue to do that work. But even without that, it's like once I figure out, because obviously, like I said, I can go to the emergency room. They can send me a bill. Nothing, it won't go on my credit report if I don't pay medical debt. Not advising you not to pay your medical debt, or saying that I won't, but just saying it's an option. I can go there, and other transgender women who maybe are lucky enough to have found employment and have insurance, not have to worry about whether or not their insurance will be refused, still have to face the discrimination of just not being treated fairly because you're transgender, of having your health issues blamed on it, of having people who just don't want to see you and have a loophole. So I don't know what I'm going to do right now, and I don't want to scare anyone, and I've got a couple of options. I just wanted to talk about this because it's not fair. It's incredibly unfair. But, doing the kind of activism work I do, and just with the kind of the remnants of all the shit I went through in my own life after coming out, I'm kind of used to facing the idea that I could die in early death as a result of being transgender one way or another. Whether it's by direct violence by someone else, whether it's by the healthcare system laying me down. I mean, fuck, I could even just get hit by a car tomorrow for no other good reason. So I've kind of had to accept that possibility and just try to, I guess, take a little bit of comfort in knowing that I've had an impact from the people who have told me I had, or have, rather. But it's still scary. As much as shit can really suck sometimes, I'd much rather live long enough to see it get better. So, anyway. Sorry. The time for us to not talk about this shit is over. The trans healthcare discussion is a conversation that everyone who cares about LGBT people, everyone who cares about women, and just everyone who cares about fucking human beings needs to be having. And I hope this will be silly tomorrow. I hope I'll look back and be like, oh wow, this was silly. I just had some really stubborn gas or something. But I don't know that that's what's going to happen. But I do know that we need to do something about it. There's been too many transgender women who have died self-medicating because they couldn't get the health care that they needed. And there's too much shit that transgender women go through just because they can't get medical treatment. Anyway, I just want to say that I appreciate every single one of you so much. I appreciate all the help I've gotten over the past couple days. Even just the concern, the messages to let me know that you guys care. Because I know that in a lot of cases that's all you can do. And I really, really appreciate it. Anyway, so I'm sorry, I'm having a hard time thinking right now. I guess that's all I really wanted to say. And I apologize in advance if this turns out to be something less serious and you know, the worry and the concern was for nothing, but I just don't know right now. So I'm gonna do what I can to find out. I just wish I had some better options. As always, thank you so very much for watching, and I'll see you next time. Be yourself.